Alrighty, so let's get started. There we go. Okay, so I want to start with just a brief overview of what we're going to be covering today. Okay, we're going to start off with a short introduction. Okay, just giving a quick statistic about rotator cuff tears and why we decided to cover this topic today. Okay. After that, we're going to get into the anatomy of the rotator cuff, okay, what it actually is. We're going to go into how a rotator cuff tear is diagnosed, the two different types of rotator cuff tears, the causes and risk factors associated with tears, rotator cuff tears, and then some of the signs and symptoms you can expect to have, okay? After that, we're going to get into some tips and information about physical therapy before having surgery and physical therapy after having rotator cuff surgery if you elect to. And then at the end, just a quick conclusion to wrap things up. Okay, so little introduction. A rotator cuff tear is a common cause of pain and disability among adults. Each year, almost 2 million people in the United States visit their doctors because of a rotator cuff problem. So it's a fairly common problem, which is one of the reasons we wanted to cover it here today for this broadcast. It's definitely something we see often in our own clinic. A torn rotator cuff will weaken your shoulder. This means that many daily activities like combing your hair or getting dressed may become painful and difficult to do. So tearing your rotator cuff or an injury to it doesn't just make lifting heavy objects difficult, but it makes everyday activities that we do quite often hard to do. So it has a big impact on our daily lives, okay? And with October being National Physical Therapy Month, we felt that this was a great opportunity to provide some important information to you guys regarding physical therapy before and after surgery. Okay, so let's get into the anatomy of the rotator cuff a little bit. First, I want to kind of just orient you to the picture we're looking at here, okay? So we are looking at the front of a right shoulder, okay? At the top of the picture, you can see the clavicle here. We have the actual shoulder joint here that I'm circling with the mouse and the arm coming down, okay? So the rotator cuff is actually made up of 4 different muscles that attach from the body onto the shoulder. And here we have an example of a few of those muscles here, okay? And here are the muscle bellies. They attach via their tendons right here onto the shoulder, okay? And with these 4 muscles attaching around the head of the arm bone or the humerus, they create like a cuff surrounding it, okay? So that's why we call it the rotator cuff. These 4 muscles work in unison to provide stability for the shoulder. So when you move your arm up and down, left and right, whatever direction it might be, it's the rotator cuff that keeps that movement nice and smooth. So we don't get any clunking or crackling inside of the joint, okay? I also want to point out on this picture a couple other things. Here that I'm circling is the acromion. This is a bony point right on the top of the shoulder, okay? So if you take your hand and you place it on the clavicle and you walk it out to either side, the boniest point here that you feel on the top of the shoulder, that's your acromion, okay? So you can see these rotator cuff muscles pass underneath the acromion and attach onto the arm. And it's a pretty small area they have here to move through, which we'll kind of get into why that's important a little bit later on. And I also want to point out in this picture, the bursa, which is labeled right here, which is just kind of blue, circular shape here. And what that bursa is, you might have heard of bursitis before. A bursa is basically like a cushion inside the body, okay? So as these rotator cuff muscles move the shoulder or move the arm up and down, they pass underneath the bursa, which provides cushion between the cuff and the acromion, okay? So here we get a little better picture, a little closer up picture of what I'm talking about. So at the top, you can still see that same bony point, the acromion right here. okay? And underneath of that is the bursa, or that cushion. And then underneath of that is one of our 4 rotator cuff muscles. This one is the supraspinatus, okay? And I really like this picture because it gives you a good look at how these 4 muscles really surround the top of the arm bone and provide kind of a blanket of control around it, so that when you're moving that arm, there's good stability and that shoulder moves nice and smoothly, okay? Just checking the questions box, looks good. So if you feel like you might have a rotator cuff tear, to be correctly diagnosed, you must see your doctor, okay? Depending on the conversation that you have with your doctor, they may recommend imaging to be taken, whether X-ray or possibly an MRI, okay? So I don't want to get into it too deep, but on the right here, we have an MRI of the shoulder, and we have a little bit of bright white on the far tip here with an arrow pointing to it, okay? Typically that bright white signifies some increased fluid or inflammation there, and can be a sign that there's a tear within the tendon or within the rotator cuff, okay? X-ray and MRI are also good to get, because if you don't have a rotator cuff tear, they can actually rule it out or rule out other possible injuries that may be going on in the shoulder, okay? So if you are diagnosed with a tear, you have 2 different pathways or options you can choose from if you decide to choose therapy. You can have therapy prior to surgery, where we'll be working on regaining any strength or range of motion that you've lost, to hopefully either avoid surgery altogether or at least postpone it for a prolonged period of time. Or you can elect to have surgery, have that rotator cuff repaired, and then have therapy after, which we'll definitely be getting into a little bit later on here. Okay, so there are 2 different types of rotator cuff tears. There's a partial thickness tear and a full thickness tear. So in the picture on the left, you can see all 4 muscles that make up the rotator cuff right here, okay? And them attaching with their tendons onto the humerus, or the arm bone, okay? In this picture, we don't have any tears. It's all nice and well connected, okay? The picture on the right is a full thickness tear of the supraspinatus, okay, which is one of those muscles and one of the more commonly torn rotator cuff muscles. So as you can see, a full thickness tear doesn't mean that all 4 muscles are torn from the rotator cuff, but just that one entire muscle is torn at the rotator cuff. So for instance, you could have multiple full thickness tears, or a combination of a full thickness tear and a partial thickness tear, okay? So we could have a full thickness tear of the supraspinatus, but we could also have a partial thickness tear of the subscapularis, and that just depends on the type of injury that you have, okay? Okay, so let's go over some causes and risk factors of a rotator cuff tear. There's 2 different causes. The first one is acute, which means sudden, so a sudden tear. In our picture here with the construction worker is a good example of that, okay? He's just slipped on some wet floor. He's most likely going to land on that shoulder, and that impact may cause a sudden tear in the rotator cuff, okay? The second type of rotator cuff tear is called a degenerative tear. And while I'm talking about this one, I actually want to back up a few slides to this picture we had before, okay? So the way a degenerative tear works is when the acromion, or that bony point up at the top here that I'm circling with the mouse, actually begins to rub up against the tendon of one of the muscles, okay? This causes that tendon to fray and then eventually tear. So that's a degenerative tear. It's a tear that occurs over a longer period of time as the tendon's rubbing against the bone. So as a result, risk factors associated with tears, being over 40 years of age is one of them, because as we age, we have more wear and tear on the shoulder, more use out of the shoulder than a 20-year-old would have, and there's more chances that we have some fraying going on there, affecting the rotator cuff. Okay. The second most common risk factor, which is pretty straightforward, but repetitive lifting, especially overhead activities. So obviously, if you're using your shoulders a lot more, if you're doing heavy lifting on a regular basis, that's a lot more strain on the rotator cuff, and we have a lot higher chance for injury because of that. So let's go over some signs and symptoms that you might have if you have a tear. Okay, pain at rest and at night, particularly if lying on the affected shoulder. Okay. Pain when lifting and lowering your arm or with specific movements. So if you remember, the rotator cuff is made up of 4 individual muscles. So if one of these muscles is torn, typically there'll be a specific movement where that muscle is being activated where you have more pain than with other movements. Okay. Weakness when lifting or rotating your arm. Okay. Same idea. If we have a full thickness tear of one of your muscles that make up the rotator cuff, we're going to have some weakness there where that muscle is no longer able to effectively move the shoulder. Okay. And the last one is crepitus, which is a fancy word for crackling or a grinding sensation when you're moving your shoulder in certain positions. So that rotator cuff is responsible for stabilizing the shoulder, like I said earlier, and it keeps that motion nice and smooth. So if we have a tear in the rotator cuff, now all of a sudden that shoulder isn't moving as smoothly, and that's where we get that crackling sound and pain that comes along with it. Okay. So let's talk about some pre-surgical therapy suggestions. Okay. So the first one is just resting that arm and limiting your activity. Okay. So if you have a particular movement with that shoulder that's painful, we want to avoid that movement as much as possible. That way we avoid doing more damage to the tear and causing more issues. Okay. Ice is a very simple, but yet can be a very effective tool to help control inflammation and swelling, and also help numb the area and manage pain. Okay. If you decide to have physical therapy prior to having surgery, depending on the type of tear you have, the kind of weaknesses or limitations and range of motion of the shoulder you might have, we'll have a variety of stretches and exercises that will help to regain that range of motion and regain that strength. But more importantly, PT will also provide a lot of education on how to properly use that shoulder for pushing and pulling and lifting activities while limiting the amount of strain you're putting on the rotator cuff. And the goal is to get you back as close as we can to a normal function while you still have the tear. Okay. If you decide to, medication and injections can also be an effective option, in which case you would want to have that discussion with your doctor and talk to him about whether or not that's appropriate for you. Okay. The last little bit I want to get into on this slide is talking about activities of daily living or things that you do every day and preparing for therapy or your everyday life after surgery. Okay. So we're going to get into this a bit more in just a second, but after surgery, you won't be able to use the arm that you had surgery on for the first several weeks. You're going to be keeping it in a sling. So essentially you'll be doing everything with one arm for that first 4 to 6 weeks. Okay. So in order to prepare for this, you can do some simple things like having shirts that button up in the front instead of trying to pull over your head, having those out so that they're easy to put on. Okay. Buying a pair of shoes that slips on instead of ties, because it is really hard to tie your shoes with one hand from what I'm told. Okay. So slip-on shoes is definitely very helpful. For women, having a bra that clasps in the front as opposed to the back makes it a lot easier for you to take on and off your bra. Also, items that you use all the time in the house, okay? Whether it's things that you typically put high in a closet, keep those on lower shelves, or in the kitchen if there's particular pots and pans or food that you reach for often, you're going to want to bring that all to lower shelves so it's easier for you to grab those items and use them with one arm. Okay, it can make your life after surgery just that much easier. Okay, so if you decide to have surgery, one of the big questions is, do I have to have physical therapy? And coming from a physical therapist, I believe you absolutely should. Okay, the reason being, after that rotator cuff tear is surgically repaired, it's back together, but it's not fully healed. It takes several months for that tissue to actually heal and return to its full strength so that you can do normal everyday, lifting and heavy lifting activities. Okay. So my job as a physical therapist is to help guide you through that healing process so that we're getting range of motion and strength in your shoulder back as fast as we can, but yet not too fast where we risk re-injuring that tear. Okay. So having a physical therapist help you with that process just takes a lot of the stress out of recovery, because if you have any questions, if you're curious whether or not you can do one activity versus another, we're here to help with that. Okay. Typically, surgery or your PT, how often you'll be in the clinic, the frequency of your visits, we suggest 3 times a week, and you'll be coming in usually for at least roughly 20 weeks, and it depends on your progress and obviously how things are coming along for the individual. Okay, so now I would like to get into the protocol that we use, or the guidelines that we use as therapists after surgery. Okay, so as I was just saying, protocol is the surgical guidelines that are made through research that basically say this is the best pace to recover after a rotator cuff surgery. Okay, this protocol is specifically for an arthroscopic procedure, which is one of the most common procedures performed. So there's 4 different phases to this protocol. The first one is the immediate post-surgical, which covers weeks 1 through 6. The second is the protection active motion phase, which goes from weeks 5 to 10. Phase 3 is early strengthening, weeks 10 to 14. And phase 4 is advanced strengthening, weeks 16 to 22. Okay, so let's get into each of these phases. Questions? Okay. So phase 1 is the immediate post-surgical phase. So these are the first 6 weeks that you're working with your therapist after having the surgery. So in these first 6 weeks, it is super important that you continue to use the abduction sling, which is just a sling that holds the shoulder in place, but kind of keeps it a little bit elevated from the body. You're going to be wearing this sling 24/7 unless you're in the clinic working with the therapist. Okay, and the reason being, as I was saying before, is even though the rotator cuff has been repaired, those tissues have to heal and develop strength. Okay, so by keeping that shoulder in the sling, it gives those tissues time to heal, and it prevents you from pulling and possibly re-damaging the repair. Okay, so some of the goals or some of the things we'll be working on when you come into the clinic are going to be, the big one is maintaining the range of motion in your shoulder. Okay, so obviously if you're wearing a sling for 6 weeks and you're not moving the shoulder at all, it's very susceptible to getting tight and restricted. So if you're working with myself or another therapist, we're going to be helping to maintain and improve the range of motion so that after this 6 weeks, the shoulder isn't locked up and really tight on you. Okay, so I already discussed you'll be wearing the sling 24/7, but some of the precautions that we have right on the protocol include no lifting of the arm, no lifting of any objects, no reaching behind the back, no excessive stretching or sudden movements of the shoulder, and no leaning on the shoulder at all either, which is a pretty big one. Okay. So phase 2 is the protection and active motion phase, which covers weeks 5 through 10. So in this phase, we're starting to wean off of that sling, okay, and beginning to actively move that shoulder more using tools that we have in the clinic and then eventually on its own, okay? So this is where we start to develop your strength in a sense, but we're not using any loads or any weights other than just the weight of your shoulder, which at this point will be plenty enough, okay? Okay, so still in this phase, unless instructed by a therapist, pretty general precautions still apply. So no lifting of the arm, no supporting any body weight through the shoulder, and no excessive behind the back movements. So we are beginning to actively use the shoulder, but we have to do it slowly and slowly add strain to the rotator cuff. So again, we don't risk damaging it, but we help begin strengthening it, okay? So phase 3 is the early strengthening phase. This is weeks 10 to 14. And from here, we are starting to actually improve a little bit more strength of the shoulder, okay? Starting to use some very small weights and different activities, okay? At this point, we're also going to be working on the stability of the shoulder. So if you remember me saying, the rotator cuff muscles, their focus is to help stabilize the shoulder. So we'll have a variety of activities that are helping to continue to maintain and improve your range of motion, continue to develop your strength, but now also working on developing the stability in the shoulder as well. Okay. Okay, perfect. In this stage, even though we are on that early strengthening phase, we're still avoiding lifting objects greater than 5 pounds. We still don't want any sudden jerking or lifting of the arm because, again, the tissues are healing. We've made good progress, but we still don't want to risk re-tearing that rotator cuff, okay? And we're still avoiding any overhead lifting as well with any, additional weight, okay? And then actually, before we go to phase 4, phase 3, we're also working on getting you back into doing some of your normal daily activities with that arm, okay? So things like, folding clothes, tying your shoes, doing some cooking in the kitchen with, not putting more than 5 pounds on the shoulder, getting you back to doing some of those kind of lighter household activities, okay? And phase 4 is the advanced strengthening phase. So at this point, it's been a long road and we're finally getting to that point where we're getting you back to your normal level of function, starting to lift with, moderate and some heavier weights. Your range of motion should be, close to or back to normal. And at this point, you're really seeing the light at the end of the tunnel, okay? Let's see here. So I'm just reading a question right now. And to answer your question, yeah, you can definitely come to the clinic for his initial visit. We just ask that you wear a mask and we are taking all the appropriate steps and measures to help prevent the spread of COVID. For his initial visit, if you've never had PT yourself, he will be in a private room with the therapist. So it'll just be the 3 of you together in that room, and you guys will be able to go over in detail and discuss, what his next, few months of therapy is going to be like and answer any questions that you have. Okay. So last but not least, I've already talked about the sling, but I wanted to put it here at the end as well, just to kind of reiterate the importance of it. This is an abduction sling here. This is what you'll be wearing after the surgery. And it is just so important that you try to adhere to wearing it as much as possible in that first 4 to 6 weeks, okay? Again, you know, I sound like a broken record, but the rotator cuff is repaired, but that tissue needs time to heal and develop strength before it has any weight that's placed on it. And so that's why this sling, even though it can be hot to wear at times and annoying, that's why it's so important. Okay. Okay. So in conclusion, early treatment can prevent your symptoms from getting worse. Definitely see your doctor if you're having shoulder pain, if you suspect you might have a rotator cuff tear, and you know, you guys can take the following steps that you need to. Although a rotator cuff tear and surgery is a slow process, being committed to the process and to the protocol is very key for success and having good outcomes. Okay. And last but not least, if you have any questions, definitely ask your doctor, ask your therapist, whether it's before, during, or after surgery. Always more than happy to answer those for you. Okay, here are our references for the PowerPoint.